Hello, my name is Karen Kiefer. I'm one of the nurse practitioners at St. Barnabas Stroke Center. I'm here today to talk to you about strokes and high blood pressure in the African American community. It's vital for me to explain the differences in your unique population so that we can make changes and differences in your health and prevent strokes and heart attacks. Race does matter. African Americans are disproportionately at risk for strokes and high blood pressure. You have 3 times a greater risk of developing complications than Caucasians. There's a 6 to 7% increase in mortality in people over 50. 40% of men ages 20 and older have high blood pressure already. And 44% of women ages 20 and older have high blood pressure. High blood pressure develops in the ages of 25 to 45, a much younger age bracket than other populations. High blood pressure affects 86 million Americans. And if you look at this chart, the highest incidence of high blood pressure is in the African American community, comparatively. In fact, if you look at the 2000 statistics from the CDC about leading causes of death, in African American males, there's 23% that has heart disease, 4.8% that has strokes, and 1.7% that has high blood pressure. When you compare it to the African American women, 22% have heart disease, 6.5% have had strokes, and 2.1% have had high blood pressure. So we have to take a look and see what we can do to change it. Because I'm looking at not just the incidence of high blood pressure and stroke and heart disease, but also leading causes of death. Now this is in the males. And if the older you get, as you see, the higher the risk becomes for heart disease as well as strokes. And the same goes for women. It's a little different, but it's high. And we have to make some changes so we can have better, healthier lives. Now, to understand everything that's told to you when you go to the doctor's office, you're told to get your blood pressure under control, get your cholesterol under control, get your blood sugar under control, and to make some lifestyle modifications. But do you really know what blood pressure is? Blood pressure is a result of the circulatory system. It carries blood through the vessels in your body that provides oxygen, nutrients. It takes away metabolites, and it transports a lot of different things that are necessary for life, okay? Now, it's comprised of arteries, veins, and capillaries. Now, the arteries are in red here. They carry the blood through the body under a high pressure. They pump it, okay? Now, the veins carry blood through the system under a low pressure, or you consider it like draining it. And the capillaries are tiny, tiny networks that promote circulation throughout the body. Now, blood pressure is the result of 2 forces. It's called a systolic and a diastolic. Now, the systolic is the force it takes to pump the blood out of the heart and into the body, where the diastolic is the resting force in between the heartbeats, or the relaxation. Now, when we talk about high blood pressure, why is it so important? What does it really mean? Now, when extreme pressure is built up in the arteries throughout your body, it affects every organ and every body system. It decreases the elasticity of the arteries. It can weaken the walls of the arteries, causing tears. You see these tears right here? And when it tears, it's called a dissection. And the tears can be in 2 different areas. It could be internal or an external tear. Now, the both tears has the potential for a blood clot to hide in there and form. And it's that blood clot that shoots up and causes the stroke or the heart attack. Now, the cholesterol lines the vessels of your arteries, and it's a sticky substance. And if you take a look here, you see how it's obstructing the vessel, it's narrowing it, it's causing a decreased blood flow through the vessel. Not only does it cause the decreased blood flow, but it has the potential for the blood cells to stick to the cholesterol, forming obstruction. And it takes more force to get past the obstruction. So these are things we need to understand when we talk about high blood pressure, why it's so important. And it's in every artery in your body. Now, there are complications that are very specific to high blood pressure, and they include a stroke, heart failure, coronary artery disease or heart attacks, atrial fibrillation, peripheral artery disease, or poor circulation in your lower extremities like your legs, kidney failure, and retinal damage, so you have difficulty with your vision. Now, when we're talking about cholesterol, like I had said before, it's this fatty substance that lines all the blood vessels. You see how it narrows the lumen of the blood vessels? See how that goes? And here's your blood going through there. Now, it's important to keep your cholesterol numbers within the normal limits. Now, the American Heart Association recommends anyone over the age of 20 get their cholesterol checked. And to be truthful, these are great recommendations because if you remember what I said, between 20 to 25 is when high blood pressure starts in the African American population. So that goes along with it because cholesterol can decrease the blood flow through the blood vessels. And remember, it can also cause blood to stick to the cholesterol and cause a stroke. So they talk about a couple of different numbers, HDL, LDL, and triglycerides. HDL is the high density lipids, which is called the good cholesterol. You want this number to be high. The LDL is the low density lipids. Lower is better. You want it to be lower. And the triglycerides, normals averaged by age and sex. And other things come into play with triglycerides. Now, when you think about your potential for health problems related to blood pressure, cholesterol, your risks for stroke and heart attacks, we need to go down a list of potential risk factors. And some of them we could do things about and others that we can't. So let's control what we can. Some of the risk factors include heart disease, high cholesterol, diabetes, smoking, carotid artery disease, or disease in the neck veins, okay? A history of a heart attack, a history of peripheral artery disease like we talked about with the poor circulation in your lower extremities. Family history of heart disease, stroke, diabetes, whether you're overweight, how active you are. If you're inactive, that's a big risk factor and you can change that. Excessive alcohol use, smoking, and illicit drug use. Now, strokes are basically the interruption of blood flow to the brain that causes the lack of oxygen to a certain area. And when the brain is deprived of oxygen, it gets ischemic or dies. Now, there's two types of strokes. There's one called an ischemic stroke, which is 87%. That's caused by a blockage of some sort, whether it be a blood clot, a piece of plaque, or any other thing that obliterates it. Now, when people talk about a TIA or a transient ischemic attack, that's a warning sign of a stroke to come. Many people call it mini strokes. I call it a stroke, but without the damage. And it's important to pay attention to. Now, the other type of stroke is called a hemorrhagic stroke, or what I call a bleed. It's 13% of the strokes. And the hemorrhagic strokes is the major player when we're talking about high blood pressure. Stroke is the 5th cause of death in the United States, and it's the leading cause of disability. So let's change that. Here's the 2 types of strokes that we discussed. Here's the ischemic stroke. You see the blockage there? And very little blood flow can get through. Okay, it can be caused by cholesterol or a blood clot. And the hemorrhagic is caused by high blood pressure or an aneurysm. There is a difference as far as percentages of this, but you don't want to play the percentages. Causes of an ischemic stroke are a thrombus or embolus or a blood clotting disorder. A thrombus is when a blood clot forms within the blood vessels and travels up into the cerebral arteries. Now, an embolus is a traveling particle that blocks the artery. It could be anything from calcified cholesterol that broke off. It could be a valve like in your heart that became rigid from an infection and broke off. Okay? And blood clotting disorders can be anything from sickle cell to any other blood clotting disorders. That's why when we work you up for a stroke, we look very closely at your blood clotting. And frequently we can get a hematologist involved. Now, the transient ischemic attacks are like a warning sign before a major stroke. It's the brief blockage of circulation to your brain. They're temporary symptoms and they go away. And then you're like, oh, I'm fine, but you're really not. You need to call 911. You need to go into the hospital and you need to be worked up. Let's see what we could do to prevent a major stroke. Because remember, stroke is the leading cause of disability. Now, when we talk about symptoms of stroke, the symptoms I'm talking about are sudden. And it's a sudden onset, something you haven't had before that's not ongoing. And I call it B fast. Every letter stands for something, and that's how I try to remember it. B stands for balance. When you're off balance or you're leaning to one side, you can't readjust yourself. Some people see that they walk to the one side or they're staggering. E is eyes, double vision or blurred vision, or where you can't see out of one or both of your eyes. F is a facial droop, or when you're drinking something, it comes out of your mouth. Okay. A is an arm or a leg only on one side, sometimes even both, that becomes numb or tingly or heavy, or you can't feel it. S stands for speech. Garbled speech, slurred speech, where you can't understand someone, where you're saying the wrong word in response to questions that's totally wrong and inappropriate. Or T is time to call 911. It's so important that you call 911 to get help right away, because there's a very small window of opportunity for us to intervene if you're having an ischemic stroke. If you're having a hemorrhagic stroke, we want to stop the bleeding as soon as possible. Our focus is to decrease the disability. Let us intervene as much as we can to maximize your functionality. Now, the causes of hemorrhagic stroke include high blood pressure, an aneurysm, an AVM, or blood thinners. What's an AVM and an aneurysm? An aneurysm is where the blood vessel wall weakens and bulges out like a balloon. And the more it stretches, the thinner it becomes, and there's a potential for it to burst. Now, an AVM is called an arterial venous malformation, which is a cluster of abnormal blood vessels. See that? Right there. Okay? And that can start to bleed. And when it bleeds, it puts pressure on your brain. And because your skull cannot expand, the more pressure that goes on your brain from the blood, the less and less oxygen that part of the brain gets, and it could get damaged. And blood thinners are also a cause of a stroke as well. That's why we talk about you following up with your healthcare provider if you're on blood thinners. Now, symptoms of a hemorrhagic stroke are, of course, a sudden onset, the worst headache of your life, like a super migraine, neck pain, light sensitivity, extreme nausea or vomiting that you can't attribute to anything. You didn't eat anything different. All of a sudden you're nauseous and you just can't explain it. A decreased level of consciousness where you get drowsy or you're falling asleep or people are having a hard time arousing you. Extreme dizziness or even confusion. So how can we prevent high blood pressure and a stroke? The main thing is to know and understand what risk factors you have. I mean, you can't change your family history, but what you can do is you can change how you respond to it. Your interventions, your personal interventions. You can do things about it. Visit your healthcare providers on a regular basis. To establish a relationship. Know what's going on with your body. Eat well, a heart healthy diet. Some people even like to eat Mediterranean diets because it's very healthy. It's low sodium, low cholesterol. You can make a difference in that. Exercise, walk, swim, jog, yoga. Do anything that keeps you moving so you're not just sitting there. Don't smoke. Smoke steals oxygen from every major system in your body, your brain, your heart, everything. Don't drink excessively because that can change things and that can put you at risk for other health problems as well as stroke. Take time for yourself to de-stress. Life is very stressful, and you can manage by managing your stress, you can decrease your blood pressure and you can be happier and healthier. And take your medications as directed if you're on medications. If you have an issue with the medication, call whoever prescribed it and talk to them. Maybe they could change it, or maybe they want to see you. It's important for you to intervene in your own health. As we've been talking about, these are all the risk factors for strokes. Again, heart disease, high cholesterol, diabetes, smoking, carotid artery disease, a previous history of a heart attack, a history of peripheral artery disease, family history, being overweight, being inactive, excessive alcohol, smoking, or using illicit drugs. Now, we always talk to people about eating a low sodium, low cholesterol diet, and that's to decrease the blood pressure and decrease the buildup of cholesterol within your arteries. And take a look, when you go shopping, look at the boxes and the labeling. Most processed foods are high in sodium, and there are low sodium options. You just have to watch for it. Now, if you take a look at a lot of the canned soups, they're high in sodium. Now, they have come out with lower sodium soups lately, and that's something you should watch for. Choose fresh or frozen things. Fill up on vegetables. When you go out to dinner, on the menus, there's heart healthy asterisks. Take a closer look at that. They're just as tasty. Now, the sodium recommendations by the American Heart Association is for people 51 and older to have less than 2,300 milligrams a day. Now, if you're looking at the sodium content on the menus, on all the packages, it'll say how much that is, and you can add it up. But it's much lower if you already have high blood pressure or heart disease or diabetes or kidney problems. It's 1,500 milligrams a day. How do we do all this? How do we figure it out? Well, since there's been a healthy preventative push within the American population, a lot of supermarkets have nutritionists on staff. You can make an appointment with them. Talk about healthy choices. Bring a pad with you and write a do and don't list for you to eat. They can help you choose healthier snacks and diets, better choices for a better life. Controlling your blood sugar is another aspect of health prevention. Do you know what a hemoglobin A1C is? That's the measurement of your blood sugar over a 3-month period of time. If the blood sugar is too high, it's toxic to your brain, your eyes, your heart, to every body system. It affects everything. It can even cause kidney damage. So we need to know what our hemoglobin A1C is. If you're at risk for diabetes, here's what us healthcare providers go by, the numbers. If you take a look, 5.7 to 6.4 means you're at risk for diabetes. And 6.5 or higher, you probably have diabetes and don't even know it. And if you are a diabetic, the goal for your hemoglobin A1C should be under 7. Now, what do the blood pressure numbers mean? Now, lately, they have put, the healthcare providers have put the blood pressure numbers into stages, and it's all to prevent complications, prevent strokes, prevent heart disease, and to define when you need to start taking medications and when you could just make lifestyle choice changes. Now, if you look, the normal blood pressure is the systolic blood pressure less than 120 and the diastolic or the relaxing blood pressure less than 80. Now, it's considered elevated blood pressure when your blood pressure is 120 to 129 and less than 80. They consider you have high blood pressure if it's 130 to 139 or 80 to 89 for the bottom number. And the high blood pressure stage 2 is 140 or higher or 90 or higher. And when they talk about a hypertensive crisis, if you hear anybody speak about that, it's when the systolic blood pressure is higher than 180 and the diastolic is higher than 120. This can cause major damage, and we need to intervene immediately. So what affects your blood pressure? So many different things. Stress, high sodium diet, high cholesterol diet, excessive alcohol, decongestants, illicit drugs, smoking, and that includes the vaping and hookah as well, physical inactivity, being overweight, or having sleep problems, reduced or interrupted sleep. Let's see what we can do about this. Stress is a major thing as far as blood pressure and heart disease and stroke goes. It increases your risk for everything. It releases these power chemicals inside your body that increases your heart rate, raises your blood pressure, interferes with your sleep, decreases or increases your appetite, raises the blood sugar, and alters your mood. All of a sudden, you're anxious or you're irritable, depressed, you're on edge. That can all be due to stress. And we can try to make choices on how to decrease our stress, because a high stress level for an extended amount of time depresses your immune system. It affects your digestive system. It affects everything. So take time for yourself every day, even if it's just a couple of minutes. Spend time and think about a place that you adore. Close your eyes and visualize it. Be mindful. Think and relax. Listen to music. Read. Do something you enjoy, a type of hobby. It doesn't have to be for a long period of time. It could be something you look forward to every day. Socialize with others. Maybe do some yoga and exercise. Those are all ways to de-stress. Now, when we talk about cholesterol numbers, it's important to understand that it varies depending on your risk factors. Now, the HDL, or the high cholesterol, the good one, higher is better. For men, greater than 40 is better, and for women, greater than 40 is better. But the LDL, lower is better. Depending on your health history, the numbers could vary. If you have heart disease or diabetes, we recommend under 100 or under 70 if advised by your healthcare provider. If you have 2 or more risk factors, under 130 is acceptable, or under 100 if advised by your healthcare provider. We want you to think about working with your healthcare provider towards your cholesterol goals. If you don't have any risk factors or only one, under 160 is acceptable. For triglycerides, the normal levels vary by age and sex. Under 150 is optimal. So, what affects the triglycerides is physical inactivity, cigarette smoking, a diet high in carbohydrates, and excessive alcohol consumption. I'm sure you're seeing a pattern by now. Remember, high triglycerides plus low HDL or high LDL is associated with atherosclerosis or hardening of the arteries. It causes fatty deposits in the artery walls that increases your risk for stroke and for heart attack. Stay active, get involved, enjoy yourself. Think about exercising 5 days a week for 30 minutes a day. It's not a lot. If 30 minutes is too much, break it up into 2 15-minute periods. Try simple strategies like taking the stairs. Try walking during your lunchtime. It doesn't have to be the whole time, but some of it. It'll get you outside. It'll make you feel better. It may decrease your stress. Get a walking buddy so you're not alone. So you could talk and you'll enjoy it and the time will pass by faster. You could join a sports-related group like bicycling, jogging, running, softball. They have all different things out now. Join a gym. Understand your health risks and work towards improving your health. When we talk about alcohol and we talk about excessive alcohol use, for healthy people, it's recommended that not more than 2 drinks a day or not more than 4 drinks at any sitting or any occasion. And I have listed up here all the different things, from beer to wine to harder alcohol. And it depends on the portions are dependent upon the strength of the alcohol. Spirits with 40% alcohol is 30 milliliters or 1 ounce. Beer is 9.6 ounces or 1.1 drinks. And wine or champagne is 3.38 ounces or 1 drink. Most wine served in restaurants is over 3.38 ounces. Look at that. What a difference, okay? Because more is not necessarily better. What's better is the quality of your enjoyment. Excessive alcohol raises your blood pressure. It increases your risk for abnormal heart rhythms like atrial fibrillation. It increases your risk for diabetes. It raises your blood sugar. It depletes the body of all the good minerals and vitamins, all the B vitamins that help you stay healthy. It interferes with your blood clotting and interferes with many medications. Smoking increases your blood pressure and increases your risk for a stroke. Smokers have 30 to 40% higher risk for diabetes. There's an increased risk for cataracts. Okay. Remember, it steals the oxygen from everywhere. It increases your risk for a stroke and a heart attack. It also has all these chemicals that are damaging to you. The arteries become less flexible. And it tends to, when they're less flexible, it tends to lead to a buildup of plaque. It increases clot formation. It lowers the good cholesterol, the HDL. It increases your blood pressure. It increases your heart rate. These are all bad things. Stopping smoking is probably the best thing you could do for yourself. You're even affected by secondhand smoke. Did you know that 1 to 5 cigarettes a day can increase your risk for heart disease? Let's think about, is it worth it? And it's so expensive. The take-home message here is I want you to think about taking charge of your own health. I want you to walk into your healthcare provider's office armed with all healthy behaviors, all questions. See the healthcare provider regularly. Nobody's perfect, and we can all work together. Tell the healthcare provider about any changes, physical and psychological. Strive to do healthy behaviors. No one's perfect. Start every day new. Participate in your healthcare. If you're on medications, take them as prescribed. Know what your blood pressure is. Know what your A1C is. Exercise. Don't smoke, and if you do, stop. If you drink, do so in moderation. We need to be part of our own healthcare prevention. We need to be able to take steps to stay healthy. I want you to consider how you can change your life, your risk factors. I want you to live a happy, healthy life. And let's all be healthy together. Thank you.